The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Roy, what do you think? What does this mean for patients? What do you think the impact of this will be? There's so few in general, like physician-owned practices to begin with now. Plastic surgery has been a holdout. What do you think this looks like?
Ideally to patients, if they like certain services, certain injectors or certain med spas, there should be no difference. I do think that if they are going to a med spa that can be improved, what happens is that it will be more efficient, both good and bad. They may get more of an upsell. They may see prices increase. A very common tactic is to have some sort of like monthly subscription, sort of like Netflix for med spas. Private equity loves that because number one, you have med spas, recurring revenue stream. Two, you have the monthly payment, recurring revenue stream. And that's what they really like. The other thing too is that you really have to know who your injector is. I don't think, in other countries, you have an allegiance to a med spa or you have an allegiance to some group that owns a med spa. You really have an allegiance to your individual injector, your individual doctor, and that won't change. But your individual doctor may be under certain constraints or may walk after a takeover.
I know. I think it's such a great thing. Plastic surgery, internal medicine, whatnot, to have independent, truly independent physicians. So I always worry a little bit when everyone and it's great being employed too. There's so many benefits to being an employed physician, but I think having that balance is great. I hope I hope plastic surgery doesn't end up going the way that essentially all the other fields have gone. So doctors don't necessarily love business. And I think that's somewhat has driven us to be in the state of medicine that we are now, in terms of physicians not having perhaps as much control as we used to, and having relinquished a lot of that to the big hospital systems and certainly the insurance companies. Let's say, you're working, or maybe you are the private equity. When you're the plastic surgeon that's like starts it, is snapping up all these practices. What are ways that would make your company more efficient?
Are you talking as a private equity side or plastic surgeon side?
On the private equity side, what would you, if you were in charge of all this and you were snapping up plastic surgeon practices left and right, what are the changes that you would implement in the practices?
Before I'd even purchase, the books have to be in order. It has to be a more organized practice. So we're not just talking about profit and making money. We're also talking about accounting practices, bookkeeping practices. The other big thing, honestly, is probably office policies, a policy manual, something where if there's an employee out, you can easily replace them, something that increases efficiency. The private equity side, holy crap. They can do so much and they're already doing so much. We have no idea. I didn't know this until I went to the conference. So some of it I came up with on my own. Some of it I know they're doing. They have bulk pricing on injectables. They can get injectables at a much lower price than you or me. They have bulk pricing on lasers and medical devices. They have bulk pricing on medical malpractice insurance, as well as business insurance for the med spa. They have lower pricing for payroll, for workers' comp, for accounting and bookkeeping and general admin. They have lower costs for medical and surgical supplies. They have lower costs on the software that runs the actual med spa. Some of them actually have talent ready to travel, and either in the management side or the injector side to hang out for a couple months to train everybody and make sure everything's better. They have policy manuals ready to go. They have training for actual injectors. And finally, if this is true in all private equity, all businesses, if you own 5 or 10 or 20 practices, you know what's average pricing. You know what's great pricing. You know what's bad pricing. You know if someone's good and they can see a certain number of patients and everybody's happy, and they see, 10 patients. And then you see other people who the patients are unhappy and they are only able to see 6 patients in the morning. It just, they know the benchmarks and all the measurements. KPIs, key performance indicators, as you probably know.
So basically, instead of, when we come in, open up our own practice, unless you're joining someone, if you truly are starting from scratch, you are learning a lot of these things on your own. I'm sure you read some books. I know I did. I was researching entrepreneurship and trying to learn it from the plastic surgery side, as well as just general principles. And you're trying as hard as you can not to reinvent the wheel, but literally these guys are just trying to recreate the processes that they know so well. And and this is what they do. They're very smart. They're smart guys in private equity for sure. So that's interesting. just having those economies of scale alone seem huge as opposed to a individual. It's interesting. It's interesting.
Yes, there are 4 ways according to this conference. I think there are only 3 ways, but these are 3 options. You could do nothing and ignore this trend. You can have a doctor-to-doctor purchase, which is the traditional way of doing things. Private equity typically wants a 5-year horizon or less. So they take over or they invest a lot of money, and they want the numbers to look better within 5 years or less to either make it hyper efficient or to sell it. They had another option, the 4th option, evergreen capital. I think that's more like a twist on regular private equity, where they want a longer term partnership and help it grow, but over 10 years or longer. To me, that's just like private equity on like a longer term scale. And what's interesting to me is that even if you ignore this problem, private equity is talking to your local competitors. They're talking to the med spas in the area. And so your local competitor may suddenly have more efficiencies, be able to do things better, may have more advertising dollars, and they may potentially be a huge competitor to you.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.